Good afternoon, and thank you very much for joining me live on WhatMed Media. For those of you that are new to the page, this is a community that we're building full of people that are caring, compassionate, interested, and wanting to basically promote the best in humanity that coronavirus brings out in us, rather than focusing on the negative. So I'm Dr Kish and Reese. I started WhatMed Media in 2015. I actually realised I thought it was 2016, but it was actually 2015. So we're coming up for 5 years old in November, I think it was, either August or November. 27 people watching already. Please share. Let's get this number up really high. We've got an extended show today. I'm sorry I'm a little bit late. I was reading through a pile of papers and it took a fair amount of time, but I've got some good stuff for you. Quick overview of the show. What we're going to do is we're going to hear from Sir David Hare, an English playwright, screenwriter and theatre film director. Sadly not actually live, but he's saw a video on, I think it was Cornwall for Europe's Facebook page, and he gave a very eloquent articulation of what it meant to be, what it meant to him to have coronavirus. I think that's worth sharing. And then Facebook then played the next video, which is a comparison between President Trump and Angela Merkel and their approach to that. So it'll help me learn German, but also I can bleach, doctor. No, keep away from the bleach. We will. How could we not talk about that? What a momentous moment that was. The page. There was a post that was commented a few days ago where we said something along the lines of, what was it? That at the beginning he just said it was fake news, and that was one of the most detrimental things that you could have done on a population-based level, right, for health. Old Trump, he's surpassed himself, hasn't he? He's now gone towards what is possibly the most harmful thing on an individual level. So we've had some Trump supporters on the page. You will see. That's fine. Everybody's welcome here. Keen for balanced, passionate debate where everybody is kind to each other. But we're also standing for dismissing and getting rid of pseudoscience, because it's just too dangerous to allow that to propagate in the world. So we're going to hear from Sir David Hare. We're going to hear the difference between Angela Merkel and Donald Trump. That's quite a long video, that one, and also it's me translating bits of it, the German bits, just reading the subtitles basically. So I'll probably cut that bit, but I think it gets the point across. Then we're going to go through the papers that I've gone through. We're going to get somebody from the team to post them as we're talking, so you can actually see the images. And also, what else? Oh yeah, I need to give a shout out to Paul, because just before I went live on air, Paul contacted me, and Paul is basically a chap who's been furloughed, and he wanted to make something that was of use. I've lost the website because I found out about David Hare. Here we go. So if I go back, it should find it. But it's basically COVID-19 in care homes, right? That's the website, if I remember properly. Let me just get it back up so I get it properly. Here we go. Report COVID-19 in carehomes.com, right? So COVID-19 in carehomes.com is, the purpose of this site is to help get real-time data, because what's really important is what Paul mentioned to me, and I haven't verified this, but I have no reason to doubt him, so if anybody on the page can correct it, that's great. But what Paul mentioned to me is that the care home data is, care home data is based on Office of National Statistics, and it's 10 days out of date. So he's noticed that there's a bit of a gap here, there's a bit of a problem, and he says the purpose of this site is to help get a real-time idea of how the virus is spreading through our care homes by allowing care home workers and healthcare professionals to anonymously submit figures on cases from their places of work. And at the bottom of it, he said, copyright 2020, absolutely no one. I like this. It's not for cash, it's not for gain, it's just to help keep my brain feel sane. Okay, so what a legend. Have a lovely little chat with Paul earlier today. Shout out to Expectations Cruises as well for supporting him in that endeavour. But as he said to me on the phone, right, the website is useless unless people put their data in it. So just hit 50 people watching. Please, when I'm showing you this audio, I'm going to do two things. I'm going to put some more suntan lotion on because I'm burning, and I need to top up on vitamin D because we've got 10 days of rain coming. So thought I'd make the most of it today. And then I also, in the comments, what I need you to do is say where you are, what your questions are, if any, and we can go through them. And just general chat really in the comments, because that will be really helpful for me. All right. So without further ado, let's hear from Sir David Hare. There this doesn't work. Hold on. So, Sir David Hare.
I caught the virus very early in the cycle 6 weeks ago, and there followed the 18 most uncomfortable days of my life. The symptoms seemed to come flying off a spinning wheel without any logic or progression. One day it would be crazy fever, next day it would be Arctic cold, then it would be vomiting, then coughing, then conjunctivitis, then breathing problems. Day 10 was 5 times worse than day 5. At the lowest point, my doctor wanted me to move me into a hospital, but I refused because, like so many of us, I was convinced that if I went in, I would never come out. I was lucky. One day the symptoms just cleared. I was among the first in and would be among the first out. Early on, I'd been shouting at the television when Pollyannas came on, claiming the virus was no worse than the flu. Thank God that lie got nailed early. And it was even more provoking when false friends of the Prime Minister started claiming courage and love of life had seen him through. In fact, whoever was in charge of his case in the week before Johnson went into hospital should never have allowed him to carry on as normal. Those of us who've had the virus know you don't, under any circumstances, ignore it. What helped me survive were pure luck and the assiduous expert care of my first-class GP. Those 2 things only, not my fabled resources of character. And that's the whole point. And the danger of this virus, nobody yet understands it. Why it affects some people of whatever age so badly and lets others off so lightly. People far fitter than me, far younger, and without any complicating conditions have died.
So just while you guys are watching this, hopefully it goes back to the same place, so I paused it. If not, I apologise. But put what you're listening, type what resonates with you, right? Because then it's useful for me to look at and see, and we can talk about it, and also obviously share and see if we can build the audience.
At age 72, I've been spared. It's not just that we don't have a cure, it's that we're up till now mystified by its character. Are those of us who had it once henceforth immune? Nobody knows. So 2 things are scaring me right now as much as the disease itself. First, in order to comprehend the incomprehensible, we're going to need information. At the moment, nurses and doctors who endured years of austerity are nobly putting their grievances behind them and doing a brilliant job of crisis management. But the equally important task of gathering facts and seeking to understand patterns, principally through mass testing, is, we all know, going by default. Unless we seek not just to treat the virus's symptoms, but to understand its hold and spread, we are doomed to fail. The second thing that scares me is tied to the first. The country has uncomplainingly entered a social contract of voluntary self-denial. But in return for lockdown, isolation, commercial disaster, and social distancing, the least we can expect is that the government will reward us with honesty. We deserve it. To watch the weasel-worded parade of ministers shirking responsibility for their failures and confecting non-apologies to the dead and dying has seen British public life sink as low as I can remember in my entire lifetime. And I lived, remember, through Suez and Iraq. As James Baldwin once wrote, allegiance has to work 2 ways, and people tire of an allegiance which is not reciprocal. We, the public, are doing what the government requests, but in return, government ministers must give something back. For the first time, they must own up to their mistakes, stop dodging and waffling, and start to trust us with the truth. I don't see how they can expect the lockdown to hold unless they do.
So that's pretty good, wasn't it? Pretty powerful words. 57 watchings, that's great. If you could like, share, comment, tag your friends in this, right? I know a lot of you are probably sitting at home thinking in shock or scared or concerned, and those are all perfectly normal feelings to be experiencing, and I've definitely gone through all of that process. But ultimately it is important to connect, it is important to get out, it is safely. We will talk through some of the what's MCDS, opening up dismay, bloody concerning. I don't know what MCDS is, Alison, but it is possible to get out safely. I think it really is important for people's mental health. Some countries, I think it was Romania, I don't know, I don't want to slander them if it's not, but it was one country, either Romania or Hungary, I'm not sure, maybe Hungary. They just banned exercise outside, right? And now Matt Hancock did threaten that a while ago if people didn't behave. And now Priti Patel is saying in the press part of this show that we'll go through. Oh, McDonald's, of course, sorry. I don't frequent Mackie D's, unfortunately. So clearly it's obvious what it was, but okay. So now Priti Patel in the press preview part of this, or review, sorry, part of this that we're going to do, is talking about stricter sanctions and etc. etc. People need to take this seriously, right? And it's amazing the number of people exercising on a sunny day compared to the number of people exercising on a rainy, cold day. So we need to be really, really careful, right? From the point of view that firstly we take responsibility for our own health, but also those around us. But also we police each other. It sounds a bit strong, but I think it's really important because there are some people out there that are either completely blasé to it, ignorant, or just they're damn indifferent to it, which is a risk and which is dangerous. Interestingly, I'm seeing more and more people wearing masks and gloves now, which I think is a good thing. That's my personal opinion. I go out and wear a mask and gloves. I encourage my family to do so because it's a case of if you are asymptomatic but you have it, you can still spread it. So you need to do everything possible to not spread it. And that works both ways, right? It's like a social contract. If everybody does that, then we're all protecting each other. Back in the early days of this, when some of the scientific advice from the government, it was from the government, but the scientific advice that was given to the government and then that came out was basically at these press conferences, and they were saying stuff like, football matches, don't worry about it, because, hold on, poor network connection, because they were saying that if you're there in the stadium, you're only going to infect one or two people next to you. Now, the trouble is, if there's 70,000 people in a stadium and that's across the country, then that's obviously going to spread it, isn't it? Because all those 1 and 2s do add up. That's my understanding of it anyway. If I've misinterpreted that, please let me know. 60 people watching, which is great. Please keep sharing and tagging your friends in this. Tracy, I completely agree. It doesn't discriminate. Anybody can get it, absolutely. The second half of this video was on a Brute Facebook page, and it was aired. These are press conferences that were aired on the 16th of April 2020, and it's basically Merkel versus Trump on reopening the economy, right? So I'm going to read out the German bits on top of Angela Merkel, so that's going to be awful from a production quality point of view, and I apologise, but then we're going to have Trump in all his glory. So what we've achieved is interim success, no more and no less, and I've emphasised it is a fragile interim success.
Economy in the history of the world, and we closed it in order to win this war, and we're in the process of winning it now.
Deshalb hat unsere Beratungen bestimmt, dass es jetzt kein falsches Vorpreschen geben darf, auch wenn die besten Absichten dahinter stehen.
So I won't do the volume. So then Merkel then went on to say, this has now determined our deliberations. There should be no rushing forward, even if it's with the best intentions. And I've just improved the audio for you guys. We have to understand that as long as there is no vaccine, we have to live with the virus. And then we're going back on to Trump.
We must have a working economy, and we want to get it back very, very quickly. And that's what's going to happen. I believe it will boom.
And then Merkel part of this is, if we now allow more public life in small steps, then it is very important that we can trace infection chains even better. And this is something that we've arguably been lacking in the UK. So hopefully there is increased provision for that, because that's absolutely essential. She then goes on to say that must be our aim to trace every infection chain. And remember, at the beginning of this, the World Health Organization were saying test, test, test. And then Trump on the 19th of April. So we're hearing Angela Merkel speaking on the 16th and Trump on the 19th.
We're starting to open up our states, and I think they're going to open up very well. We're going to be watching it. We're going to be watching it very closely. We're working with them on testing. We're working with them on whatever they need. I don't think they need ventilators anymore.
Die Kurve ist flacher geworden.
I understood that bit, actually. I didn't have to read it. But the curve has become flatter. It must not overload our healthcare system. and we have looked at calculations showing we're currently at a reproduction factor of 1. This is good, meaning one person infects one other person. That's the R number that they're talking about in the press conferences. Merkel then goes on to say that's an average, and it's true for only one infection chain, but it's approximately one infecting one other person. And this is why I think you're going to see the change in scientific advice in the coming week or so, maybe 2 weeks. I don't know, I'm just guessing and just commenting, looking at my knowledge and looking at kind of what's happening elsewhere in the world. It wouldn't surprise me if government advice changes to increase the awareness of masks. I think that would help. I think that's sensible. I think, yes, there are problems with them, don't get me wrong. If the mask becomes too moist, then it can be a problem, right? If you breathe into it so much that it's soaked with spit and it's wet. But then, you know what? Guess what? We just need to treat people like adults, and if not, educate them so that they understand, right? But anyway, so that's Merkel, and then we're going back to Trump.
Say the curve has flattened and the peak in new cases is behind us. Nationwide, more than 850 counties, or nearly 30% of our country, have reported no new cases in the last 7 days. Because of our early and aggressive action, we have avoided the tragedy of healthcare rationing and deadly shortfalls that have befallen many other nations.
If we assume that every person infects 1.1 other people, we will have reached the breaking point of our intensive care unit beds by October. Look at the difference in quality between how these two world leaders are communicating, right? And thank God we live in a social media age where we can choose which world leaders we want to listen to. But anyway, if that rate is 1.2, in other words, 20% more, so out of 5 people, 1 infects 2 others, and 4 people, 1 other person, then we will have reached the health system's breaking point in July already. Now, we need to bear in mind also, hey Alex, how you doing? But we also need to bear in mind, right, that Germany also started out with more beds, okay? They've built more beds. They tested everybody at the beginning. They implemented doctor taxis, and they also had a plan. They started planning from January, worst case scenario. When they noticed on the 31st of December that this was happening, they started implementing their plan. So it's really interesting to think that Germany's healthcare system was better set up for this and has done more and pumped more in, and also taken a slightly different approach. But listen to the way that Angela Merkel speaks. Listen to the way that Angela Merkel educates the populace in terms of why it's so important. And when we get to the press preview where we see Priti Patel in the, I think it was the Express, or I don't know what it was, we'll find out. But, you know, just this authoritarian, do this or you get locked up approach, it just won't wash with members of the public, right? Because I think people are scared and they need to understand what's going on, and that has to be the role of government, whoever the government of the day is, to educate the populace appropriately. If Germany is doing it and Angela Merkel is doing it, then we should all look to see what best practice is. Anyway, so Angela Merkel goes on to say, if that rate is 1.2, we've done that bit, then we'll have reached the health system's breaking point in July already. With 1.3, which does not sound a lot, after we came down from 3 to 5 infections, the breaking point will be reached in June. So we can see how small the leeway is we're talking about. None of this modelling is coming out in the UK. None of the advice from the Scientific Advisory Committee or Group for Emergencies is coming out, is being published until after the pandemic. Although the membership of SAGE is kept secret, I saw in the press today that Professor Chris Whitty and Sir Patrick Vallance were apparently saying that they weren't averse to the idea of the membership of that committee being published if it meant that public confidence was increased. And I think that's great. That's a good step. We need to know who's advising the government on this, and what is their background, what is their expertise, what are they giving, what is their advice. Because otherwise, again, a vacuum of knowledge or information just means people make stuff up and they report on the fact that Dominic Cummings is at SAGE meetings, right? Now, I don't really care if Dominic Cummings is at SAGE meetings, ultimately, remember the other video that I did where I said why we needed to back Boris and Dom, which was a bit tongue-in-cheek at the time, but I made a serious point in terms of if you believe in democracy and Boris Johnson won the election resoundingly and convincingly, then you've got to let him appoint his team. I mean, and considering he's convalescing from COVID-19, right, and he's in hospital, I don't actually, or sorry, he's not in hospital, he's at Chequers, but I don't actually think it's a bad thing for his head advisor, or I'm not sure what his title is, but for Dominic Cummings to be in the room knowing and getting an understanding of that science, right? Because then at least then we can see that hopefully communicated to the public. But anyway, so we can see how small the leeway is we're talking about. I don't have to translate, I can just have a little rest now, look.
I
think you're going to see quite a few states starting to open.
If you can keep sharing as well, I don't mind talking. Oh no, this is the best bit. A beautiful puzzle. Listen to this.
Pieces, all very different, but when it's all done, it's a mosaic. When it's all done, it's going to be I think, a very beautiful picture.
But I mean, look at how he's communicating, right? It's short sound bites, it's imagery, it's a beautiful picture, it's a mosaic. This is, I can't remember who wrote about it, but somebody wrote saying that when a populist leader gets elected on sound bites and they don't convert themselves into a leader in a crisis, then we get this kind of stuff, right? Look at the state of some of the stuff that's coming out of Trump. Not least, we haven't even got onto the bit where he's suggesting people inject bleach to themselves yet, but I think that is coming, but you've seen enough of it. And also, I'm not going to propagate it anymore, right? Because sadly, because of the position of power and authority that he holds, when he speaks, people will do that. Thank goodness Dettol published a great piece advising people not to do it. But you know, what a world we live in from a social media age and social media point of view. Who would have thought that if somebody said that even in January or December last year, saying that Donald Trump is going to suggest people inject bleach and Dettol are going to have to publish a rebuttal, it really is a crazy, crazy situation. But anyway, Angela Merkel goes on saying, we're almost at the end of this, the entire development is based on the assumption that the infection rate is manageable and that we can track it, and that we will have more safety concepts, and that with more safety concepts, more easings will be possible. This is the kind of communication that we need. But then, this is a terrible translation of the surname, I'm sorry, but as Mr. Tatsenshire, I don't know, said, the situation is fragile, and we're in a situation where caution and not exuberance is the essence.
I think we're going to have a lot of states open relatively soon. We're beating the date. I set a date of May 1st, and, you know, here we are. And I think you're going to have some nice surprises over the next few days, and that'll be before. And that's big stuff. Some of those states are big. They're big stuff. Big, very important states. And it's going to be added on and on.
And therefore, I hope that all of you keep working on it and keep following the rules. And this gives us another piece of public life that we're used to having. But in the pandemic, it means living differently with different rules.
And by the way, other countries are...
I'm going to cut Trump. I'm not going to give him any more airtime. He's cut me a couple of times on Sky, so holding some press conference, and they cancelled me appearing. But anyway, I'm not bitter about that at all. So, 67 people watching, thanks very much. I don't know how long I've been going for. If somebody could let me know the time, I would really appreciate it. What I'm going to do now is go through some of the press preview. So, helps with confidence that Angela Merkel comes from a scientific background. I didn't know that, Mel, but it shows, absolutely shows. And there was another comment that I saw, but I've forgotten it. So if you put some stuff, if I glance at it when I look up from the iPad looking at the papers, but in the Times today, in the supplement, weekend supplement, it says how to be happy now, the best ways to improve mood. I think that, that's great, Lisa. I think that's really important, how to improve mood, and I think look at that and do that. But the front page at the Times was COVID secure offices to get Britain back to work, right? Now, I know it's back to front, but my concern with that is obviously they're balancing between the economy and between health, right? That's always been the situation that we've got to do, and we do need people to get back to work as much as we can, but also we need to do it in a safe, controlled, calm manner that is actually appraised, right? Because if we look at how we went into this, beginning with the herd immunity plan, which spectacularly was changed very quickly. What we need is lots of people contributing this from across the political spectrum, I would suggest. But anyway, that's just my personal opinion, so we can see. So that's my concern with COVID secure offices would be that we need to make sure that it's done safely, basically. So that's the front page of the Times. Then inside the front cover, they've got a coronavirus summary, which I thought was quite good. But the thing that I'm going to pick out from that is their comment from Matthew Paris. And he says, when you hear ministers intone that they'll be guided by the science, in inverted commas, raise both eyebrows. So I've got a photo of that. We'll go through that. That will be posted as well. Fine. So there's that. Okay. Compulsory virus test could get travellers back in the air. I think it's amazing how we've had flights coming in and out, chartered flights coming in and out without people being tested. I know in some airports they might have thermal imaging and cameras and testing. I know they have it in China. Whether they have it in here, I'm not sure. Patricia, COVID secure schools, university, shops, care homes, unrealistic. Well, you know what, Patricia, I think there is elements of it being realistic, but I think it's going to take time. And I think in terms of the nudge, yeah, it has changed, Irene, but it doesn't mean that we can't still critique it, I would suggest, though, just so that we can learn lessons moving forward. But with the nudge element of this, right, people are having a go saying we shouldn't be using nudge, behavioural psychology. Dominic Cummings is some quote unquote evil genius and he shouldn't be doing it. But you know, I think nudge, to an element of nudge, is actually quite useful, because what we are needing what is becoming evident over a prolonged period of time, possibly 12 to 18 months, right? Yeah, guided by the science or defecting blame, great point. But what we need to get to a point, and this is why nudge is useful, is until a vaccine comes over the next 12 to 18 months, right? What we really, really need to do is get people to behave in a socially responsible manner. Okay, and there's a great article about exercise and running and responsible running. That's a campaign I'd love to try and start, but not that I can run. But so we've got that paper as well, right? Because I tell you what is not sustainable is everybody just staying in their homes at the moment. Died from taking fish tank cleaner as a virus remedy. BBC reported a man died from taking fish tank cleaner as a virus remedy. Candy, thanks so much for sharing that. If you can send me the link, that would be really helpful and really useful. I might as well share with you guys, it's no secret, but I'm also going to be writing an MD, which is a Doctorate of Medicine, on, the use of media, both mainstream, social and print, in a global media pandemic. Because what I'd really like to do is make sure that we learn the lessons from this pandemic, so when the next one comes, in 5 years or whatever, because it will, when the next one comes, we're in a better situation and we're not using the 1918 playbook from when Spanish flu ravaged the world. Okay, so there was that one. Compulsory virus test could get travellers back in the air. Number 10 drops China from death toll list. Downing Street has removed China from list of international comparisons over concerns around the accuracy of the country's figures. This is a fantastic piece in the Times, page 5, and I would suggest you go out and get it if you can. Go out, stretch your legs, go for a little walk around the shop safely. Oops, I shouldn't have done that. Hold on, where did it go? So the Times has basically done this. Okay, so you can't see it, it's back to front, but at least you can kind of see what it looks like. Now, the reason that this is good is because it breaks down antiviral drugs, contact tracing, herd immunity, and vaccine, right? And at the end, it says usefulness. So antiviral drugs, basically it says unknown is the usefulness, it might help. Contact tracing is medium, herd immunity is low, and vaccine is high. And I'm going to read some stuff about herd immunity. Right, so a key epidemiological concept became a politically charged phrase after claims that Dominic Cummings wanted a herd immunity strategy. Ultimately, humans have only beaten viruses through herd immunity acquired by infection or immunization. It does not require everybody to be immune, just enough that the virus cannot find new hosts. The more infectious a disease, the more people need to be immune before it dies out. For coronavirus, herd immunity is probably about 70% of the population. If the theory goes, the spread of infections can be managed so that those who can weather the disease from this 70%, or form the 70%, and the vulnerable are cocooned, locked down, can be eased, right? So, that is interesting. It's certainly not what the World Health Organization said, but anyway. And then basically the reason why they rate that as low is because there are too many unknowns coupled with too high a death count if it goes wrong. So that's not a great idea. So how Britain can beat COVID-19, it will be appearing in the comments shortly. So feel free to read it, have a look at it, see what you think. All right. So then the next story that I was going to go over was Find the Gap, give runners a wide berth. And what this is about is it's saying how to exercise safely in public, and it's giving you the recommended distances. And they're saying that if you're basically, I'm not going to read all that because it's quite detailed and quite technical, but what we need to do, right, is if you're exercising, you need to do it in a responsible manner. I know drivers hate cyclists, right, but if we could just try and end some of those hostilities, right, please, just do it. I don't know if you can hear that, but some kids having a strop down there. But anyway, if we can just suspend hostilities, right, so that drivers don't hate cyclists anymore. Because if I'm cycling in the road, right, and there's no cars, or maybe one car, and there's a pedestrian here, I will cycle in the middle of the road. And it was interestingly, when I was cycling yesterday, there was a guy who interestingly had a disabled badge in the background, so you might think that you'd want to be kind of understanding about it. He gave me a certain hand signal, which I may well have reciprocated, because I was in the middle of the road. The guy who was walking was like, thumbs up, thanks very much. That's a hand signal that I will reciprocate, right, and I'm happy with, and we're saying thanks to each other because we're being respectful of each other. But this car, like, you know, there's no traffic on the road. It didn't cost him any time. There is no need to be difficult about it. And on this thing, in terms of running, find the gap, or what was the title? It says find the gap, give runners a wide berth. So I've been thinking about this a lot, right? And in New Zealand, back in the early days of this, what they did was they shut gyms very, very quickly. And they shut gyms because they realised that people could be super spreaders. So you've got these people pumping iron and spreading sweat all over the place, right? So the reason that we need to be careful and considerate and stuff is if you're running through the park and you're sweating like some kind of animal and it's going all over the place, then we need to be mindful of the fact, hey Laura, we need to be Kirsty, you're right, we need to be mindful of the fact that these people are not running next to somebody who's elderly or going out for a little walk, or could still be young and still get it, right? We just need to keep that social distance. And it is an incredibly weird thing to do because we're humans, we thrive on social contact. We're not used to keeping this kind of distance away from us. But I remember on the 15th of March, I was doing this in the office because I was ahead of the science. I was looking at it and saying, just keep away from me. I don't know whether you've got it. I don't know whether I've got it. Keep that distance, right? And I can remember being told in the office, oh, what's wrong, Kish? Are you all right? Are you okay? Is there something wrong with your mental health just because you're like this? And I'm like, what? it's an absolute nonsense, right? So we really need to educate the populace at scale and quickly, because as Angela Merkel says, that coronavirus is going to be with us for the foreseeable, and we need to see. I don't know, Danielle, I can't go into that, but what we do is we need to see people taking socially responsible measures so that we can all enjoy life in a safe way, because otherwise there's so many knock-on consequences of this lockdown, right? There's the mental health ones, there's the rise in domestic violence that's gone up. I've got some numbers in another paper shortly, and also there's the missed kind of opportunity cost of patients not getting treated for diseases that they could be, because we're basically seeing a return of medicine to the dark ages, which I will not stand by, I will not let happen. We've got, I think it was the British Heart Foundation are saying that they've seen a 50%, someone else said they've seen I think Sir Simon Stevens said they've seen a 50% reduction in A&E attendances, and I think it's around 60 or 70%, don't quote me on it, but it's a lot of people that are no longer having stents for heart attacks, right? So in the past, you'd have a myocardial infarction, one of your coronary arteries is blocked, it needs to be released to allow oxygen into it, and you could go to a cath lab and have it done and have it fixed, right? So that's not happening now. So people sadly are dying at home. So there's so many costs from this lockdown. So anyway, there's that. Let's just go through some more of these. I can see it much better now without glasses, that's good. There's also So yeah, that will appear in the gaps. That will appear in the comments, so you can have a look at it. We've highlighted it. Let's have a look. The next one is domestic abuse arrests. Here we go. So an average of 100 people a day in London are being arrested for domestic violence offences during the lockdown. The Metropolitan Police said since March the 9th, when people with symptoms were asked to self-isolate, cautions and charges have been up 24% on the same period last year. Officers have reported finding it much easier to arrest suspects who are often at home. So that's good. Well done, police officers. But also well done to the partners of domestic abuse that had the courage to speak up and phone the police and get these yobs arrested and charged. Well done. Delivery trains trial, we're going to see some trials being done in Southampton, Portsmouth and Isle of Wight. The aim is to cut more than an hour of the journey time via road and ferry. So that's quite interesting. Here we go. Trump ridiculed for saying a disinfectant injection could help. Now, Dr. Deborah Birx, appropriate surname, one of the president's virus experts, winced at his comments. Wow, isn't that strong? Wow, Dr. Birx winced at his comments. People were saying that if she spoke out, she'd have been fired. I would rather be fired and stay true to my medical training and principles, which is do no harm, and the Hippocratic Oath, than sit idly by like, I don't know, some kind of ornament. But anyway, Reckitt Benckiser, shout out to the British company that makes Dettol and Lysol, released a statement warning people not to self-medicate with disinfectant. The White House claimed that Mr. Trump's comments had been irresponsibly taken out of context. So obviously, from a legal point of view, I have to mention that. But the footage is out there, so you watch it, you see what you think. There was another point I was going to make on that. What was it? Oh yeah, so there's somebody in the UK who's a podiatrist. Oh, there's more actually on this, I won't shut this, but there's a podiatrist, I believe, in the UK somewhere who's advising something called MMS, which sounds great. Sounds like miracle medical solution, and if you YouTube it, there's loads of trashy videos about it. But what this woman in the UK within the last 6 to 8 months was suggesting was as a cure. Now, this is not medical advice, this is absolute pseudoscience, and however, in order to debunk it, I need to share with you what that pseudoscience kind of was put out there. And they're basically saying using MMS, miracle medical solution, which is bleach, via the rectum or the mouth to cure autism. And there's this horrific quote. Firstly, it doesn't cause autism. I don't really need to say that. But there's a horrific quote out there saying something like, oh yeah, if they can only take 2 or 3 drops via rectum of this stuff, maybe you'll just have to make do with 1, right? Absolute nonsense, absolute pseudoscience. This woman should be struck off. She's working in a private clinic somewhere. I can't remember her name, but I'm sure if you Google it, you'll find it. Absolutely outrageous. Ministers can't keep hiding behind the science. And this is Matthew Paris. It's dishonest and cowardly to keep pretending that how and when the lockdown is lifted isn't a political judgment call. And then I've only highlighted a part of this article, so the whole thing will be in the comments for you to read. But Matthew Paris writes, great panics spawn great myths. In the shape of the science, the crisis has conjured up a spectacular unicorn, and British politicians are hiding behind it because they lack the courage to share with us the political, and he emphasises political, not medical choices that they must make. They're afraid to take ownership of the trade-offs that only politics can settle. Trade-offs between deaths caused by one disease and deaths caused by the less immediately in the public eye. That was the MIs, the heart attacks that people are having. 68 people watching, thanks very much. Please keep sharing. I didn't mention, we've reached 913,000 people in the last 28 days, right? So try and get it to 1 million, please. If everybody keeps on hitting like, comment, share, whatever, Facebook will serve it up to more people. I haven't spent any of your money yet. I think there's just under £400 for adverts. Obviously, I don't need to if it's reaching 1 million people. So let's keep doing it. If you do want to contribute to the crowdfunder, you can find the link. I can post it in this afterwards. We are doing a crowdfunding campaign where we're going to serve up Facebook ads for this content. But we're doing all right without money at the moment. 913,000 people, and the engagement is, I can't remember what it is, but it's high. It's significant. So thanks very much. Yeah, keep the emojis flowing. That's great. It's much more fun for me to watch. And please kind of tag your friends as well. But anyway, political choices that they must make. They're afraid to take the ownership of the trade-offs that only politics can settle. Trade-offs between deaths caused by one disease and deaths caused by less immediately in the disease by one disease and deaths caused by others less immediately in the public eye. Between the longevity of the elderly and the education of the young, between mortality in April 2020 and debt that will scar a whole generation, between loss of life and loss of livelihood, they shy away from levelling with us on these things, and shy perhaps from levelling with each other too. Instead, they pass the parcel to the science, as if science alone will make the judgments they know must, in the end, be political. What a fantastic piece, and I completely agree. This follow the science, right? If I hear those three words again, I'm going to be really upset, because for those of you that are watching, right, science is about being open with your thinking. Science is about sharing your work. Science is about peer review. Science is about getting other experts from around the world to critique your thinking and improve it or replicate it. So, you know, we had Get Brexit Done. We had to take back control. We had 3-word little kind of political slogans and taglines that did very well. I feel qualified to comment that we must not allow follow the science to be the next one. All right, we just cannot allow it, because it's not science. It's nonsense. I can't say that. It is a nonsense that scientific principles are not being adhered to, okay? And because scientific principles are not being adhered to and the advice isn't being published, let's have an open and honest discussion with the public, right? So where they get appraised of the facts, ultimately. If somebody could tell me, let me know how far I'm going, where I'm on, that'd be really good. Got a few more stories left, and I can't really see the iPad anymore, it's too bright. Let's have a look, hold on. So, ministers can't keep hiding behind the science. This is quite a funny cartoon, which can be ordered from timescartoons.co.uk. In a spirit of bipartisanship, I invite Joe Biden to be the guinea pig for my new wonder drug. And then he's standing there with Dettol with bleach and an injection and his really, really long tie, which I thought was quite funny, wasn't it? So I've got a few of those. Obviously, we've shared this as well. You have the opportunity to mark yourself safe from Donald Trump's medical advice, so please do that and make the most of that. Janice Turner, I think also in the Times, was saying the old have the right to decide what's risky. You are a Trump. This is the Daily Star, I think, and so the Daily Star is basically a comic, right? And the only reason I bought it is because I thought it's important to see what information is going out in those kind of publications so that you can be aware of it, right? And this is the inject disinfectant advice that we've talked about. The only positive thing that they said farce, Dr. Deborah Birx and a mock-up of Mr. Trump on Twitter. And said mock-up is it looks like he's wiped off his skin or the fake tan, I don't know, whichever one it is, with disinfectant. Here we go, Daily Star, we will fight him on the beaches. Bleachers, not beaches. See what they did there? Very clever. Ricky Gervais, I thought this was quite cool. £12 million TV star is laughing all the way to the bank. He says, I had no money until I was 40, but I still had everything. My mum, she gardened, grew, cooked, sewed, knitted, decorated. She gave me everything I wanted except money. It showed me the value of everything. People ask me why I dress like a tramp. I think this is why I've got this, because I go out dressed like a tramp. Sometimes when I'm cycling and things, and he goes, I say, my clothes are clean and comfortable. Who am I trying to impress? I don't wear a 50 grand watch. I don't collect cars because I can't drive. I realised growing up that the best things were free. Friends, nature, healthcare. That's why I gladly pay my taxes and why I clap the NHS. I thought that was important because I think it does put quite a lot in perspective, which is quite good. There's one piece in the eye which is silk, cotton or chiffon, I don't know how to say that word, could be useful in homemade masks. Surprise, surprise. I think we'll see that advice coming in the coming days and weeks. The eye lead with blood plasma hope for treating coronavirus. All that I would say is that I haven't looked into the details of this. However, I work in the pharmaceutical industry and I wouldn't be allowed to make a claim in a drug advert saying blood plasma hope for treating coronavirus. You're not allowed to do that. So we really need journalists to up their game in their reporting. That would be great. Some of these adverts, so this one, you'll have seen this one. Coronavirus, got symptoms, even mild ones. I want to see if I can read backwards. Do not leave the house at least for 7 days. I can't read backwards at all for 7 days. still have symptoms after 7 days, do not leave the house until they go. Everyone else in your household must not leave for the house for 14 days. Do not to go out to even buy food or essentials. Stay at home to exercise. Coronavirus got symptoms, even mild ones. So that one is important. Daily Express, Patel warns selfish rule breakers. Let's try and not blame people, right, for exercising. Let's try and also remember that this is a global pandemic. We are all in this together, to coin a phrase that David Cameron once used. I think he said that, didn't he? And people going out exercising, they're just trying their best, right? They're trying their best to keep fit, keep healthy, stave off the mental health earthquake and tsunami that is going to hit us after all this. So let's not try and be too critical. Let's not try and blame people for being fit and healthy and taking the strain off the health system elsewhere. I screenshotted them a while ago, but I saw some horrific comments on LBC where they were saying to people that, oh, like, if you're fit and healthy, you can not exercise for 3 weeks. Don't worry about it. That is a nonsense. Because that is a complete nonsense, because it's muscle memory, right? You lose it if you don't use it. So let's just try and be understanding. But then equally, I do understand Priti Patel's frustration, and I think I've got the article that we'll talk about that in a sec. Richard and Judy writes, right time to bench the B team. Now the crux of this, I'm not going to read it all because the iPad is heating up and getting a bit tired, but the crux of Judy's article, which again will be posted so you can read it and look at it, is basically that back in the day, 23rd of March, daily press conferences seemed to be a great idea. Now, especially with Johnson not there to hold it together, the various people that they wheel in and out, some are impressive performers, some are not. I won't go into more details than that. But she's saying that it'd probably be better to have twice weekly press conferences, because then we save it for information that's actually relevant. Now, I guess it's a difficult thing, isn't it? I mean, you've got to balance up getting the information out to the public, and you've got to make sure that people are taking it seriously. But equally, I think we need to have a significant consideration of what are the knock-on mental health impacts that media are having on people, and that will be one of the things that I'll explore in the MD. Fine, I think that's it. I've got to the end of the papers. There was Priti Patel's thing that I got as well. Oh no, there's one or two more. Hold on. So this one is 1 million shun A&E. 1 million fewer people have attended A&E in England this month, sparking fears deadly problems are being missed. There were 2.1 million attendances at A&E in England in April last year, but visits this month were 50% lower. The British Heart Foundation reported a 50% fall in heart attack patients at A&E, and Cancer Research UK said the number of urgent referrals by doctors for urgent hospital checks was down 75%. The NHS will launch an ad campaign next week urging sick Brits to visit their GP or hospital or dial 999 or 111. NHS England's Sir Simon Stevens said you should seek help in the way you always would. Ignoring problems can have serious consequences. So that's, at least they're doing that ad campaign finally. We'll see what that's like when that comes. We'll have a look at it. Flout off order. I thought that was quite a good pun, quite a good headline, sorry. And then it's COVIDiots. I see what they tried to do there in the sun. Risk tougher restrictions. Priti's crackdown threat. More at beach and parks. Traffic sneaks back up. Yeah, but I think, government messaging at the beginning of this needs to kind of play a role and needs to be taken into account in this, because there's such a confused message at the beginning. So many people were just saying, "Oh, it's just the flu. Doesn't matter if you're young. It doesn't matter if you get it." There was a load of nonsense that was propagated out there, right? So I think they need to own their mess as well, to a certain extent. And I'm not saying that to be overly critical. I just think, well, maybe own their mess sounds overly critical, but I think they need to be willing to learn from a rapidly changing and evolving situation. And I think we just need a slightly kinder press, where we're not kind of castigating, is that a word? Or chastising people, or kind of just making people martyrs. So, or blaming certain groups. I think this is quite a good thing that I saw on the COVID-19 in care homes website, which was, and once the clapping stops, key workers aren't just for pandemics, they're for life. Thought that was excellent. And our key workers support everyone, pay them, protect them, respect them. I think that's fair enough. So that comes to the end of this video, and thank you very much for watching. I really appreciate you sharing some of your time with me. I hope it's been useful. I hope you guys look in the comments and you can see the press cuttings that we've posted there for you. And what I'd really like you to do is use this video this weekend to talk to people in the comments, reach out to people on Facebook who you don't even know, say hello. So I watched this What Med Media video and I thought I'd say hello, because you know what, you might just make somebody's day. You might make somebody's day who's really lonely, really kind of isolated, and you know, that stranger danger narrative, let's just ignore it, right? Let's just be sensible. We don't need to be so overly concerned about stuff that we are paralyzed by fear and we're not going to reach out to people. So make the most of the comments, make the most of the people that are chatting, make the most of the press articles that we've selected and that we've got in the comments, because the more you comment, the more you interact with each other, the more you share this post, the further it will go. And I'd really like to get to 1 million people in 28 days. Wouldn't that be a great number to reach? And that's the kind of level that we can really make impact. If you would like to contribute to our fundraiser, I will put the link to it in the description once this video is uploaded. I will probably do a watch party on my own page so you can watch it on catch up again. Thanks so much for watching. I know it's tough out there. Look after yourselves and each other, and I'll see you guys really, really soon. So all the best. Cheers, take care, and I'll see you soon.